One of the best ways you can reduce your chance of having cardiovascular disease, that means a heart attack or stroke, is to know your own risk. Know the likelihood that you're going to have one of these events, and that means knowing your ABCs. A, your A1C, and this is the likelihood that you either are going to have or that you have diabetes. B is your blood pressure, checking your blood pressure either with your doctor, your healthcare provider, or even at home. And C, knowing your cholesterol. These three together can help predict the likelihood that you will have a heart attack or a stroke, and can also give us an opportunity to make interventions, make the changes to reduce that risk so that you can live a long and healthy life. One of the important tests to check with your doctor is your blood sugar. We use a test called a hemoglobin A1C that lets us know how your blood sugar has been doing over the course of a few months. How often you should have it checked is really dependent on you and your risk factors and a conversation you should have with your physician, but everyone should know their levels.
A normal A1C is below 5.7. Between 5.7 and 6.4 is categorized as pre-diabetes. A person has diabetes when the A1C is 6.5 or above.
Everyone should get their blood pressure checked. People who don't have high blood pressure, who are otherwise healthy, they may be able to get it checked as much as once or every year or every other year. People with hypertension, though, should be checking it more frequently to make sure that their blood pressure levels are under control and that they and their doctor as a team are doing the best they can to reduce the likelihood that they have a heart attack.
A healthy blood pressure level is considered less than 120 over less than 80. Between 120 and 129 over 80 is considered elevated. Once you have a blood pressure of 130 or higher over 80 or higher, that's considered hypertension. Ideally, your total cholesterol should be below 200. Your LDL cholesterol should be below 100. Your HDL cholesterol, which is the kind that's actually beneficial for heart health, should be above 60. Finally, your triglycerides should be under 150.
For people who are living very healthy, you may be able to get this checked as infrequently as once every 2 or even 5 years. But people who have a lot of risk factors for heart disease, obesity, high blood pressure, diabetes, or family history, there are people we would like to check these levels more frequently to make sure we're doing everything we can to maintain your heart health. The best advice I can give is to meet with your healthcare provider. Ask them explicitly that you want to talk about your cardiovascular health and you want to get a sense of how you're doing. Working with your team and working with your healthcare provider to promote your cardiovascular health is one of the best first steps you can do